So we're here again with Francesca doing her physical therapy for her knee. As you can see, that's her knee. It's getting a little bit better, less inflamed. So today we're going to be working with the TRX, and we're going to show you how you can recover with TRX when you have injuries or knee surgeries. Okay, Frenchie, are you ready? Okay, let's go. So we're going to start right there. So first thing we want to do is separate your feet a little more, 45-degree angle. Okay, now you're gonna sit, but don't sit all the way down, just a little bit, 45 degrees. That's good. Then up and pull. Good. Now let's go down again. Sit a little bit. Very good. Up and pull. Very good. Let's do it one more time. Sit a little bit. Up and pull. Very good. Now the next one, you're gonna sit and try to go a little lower, but feel your knee. So you're gonna stretch. So sit a little lower. When you feel the stretch right there, then pull with your arms. Very good. Okay, let's do a couple more of those. Pull with your arms. Very good. And your last one. Pull with your arms. Very good. Now we're going to stretch a little bit those knees. So what you want to do is put your palms right on top of your kneecaps. That way you're going to support your kneecaps. And now just slightly move your knees in circles. Very good. Just a little bit. Very good. We're going 5 times towards each side. 5 times in one direction. Very good. Now we do 5 times in the other direction. We're going to do another exercise for legs. This is actually good for your upper body, but also is doing your physical therapy on your knees. So what you want to do is you want to separate your feet just a little more. If possible, slowly, kind of like slide it out. Good. That's probably good. Okay, 45-degree angle, very good on your feet. So what you want to do is you want to do a push-up, right? Very good. And then once you go back, try to stick your butt out and sit just a little bit. It doesn't have to be a long angle. Yeah, right there. And then let's do it 5 times. Very good. Stick that butt out. Yes. You don't want to put pressure on your knee, and you don't want your knee to go over your toes. That's why you need to stick your butt out and keep the knee behind the toes when you flex. Very good. Let's do a couple more. And just one more. Good job, French. So now we're doing lunges with the TRX. The reason why I like to use the TRX for therapy is because you can actually hold your body weight just by grabbing the TRX. So grab the TRX. Okay, now just do a lunge. Don't bend too much, just a little bit until you feel the stretch. Then go up, and you can help yourself pulling with your arms. Okay, let's do 5. Very good, that's 2. That's 3. Good, that's giving you good flexion without putting the pressure 4 and one more, without putting the pressure of your body weight, just because you're holding the TRX, so you're controlling that weight you apply to the lower body. Very good. Now we're going to switch to the other side slowly. Yeah, just go slowly. Very good. Okay, ready? Same deal. Now the knee that is going to be bending forward is your wounded knee. Very good. Keep the weight on the back, not in the front. So that's a good thing you're doing there. See the back. Very good. So now we're gonna do another exercise on the bench. So Francesca is actually supporting her body weight on her elbows, right on the bench. And now she's gonna flex her knees, kind of like doing a squat, but taking most of her body weight off her knees so she can stretch it. So we're gonna do 10 of those. Okay, Frenchie? That's 2. 3. Very good. You wanna feel about 20% of pressure on your knees. You don't wanna really feel a lot of it. You're stretching that. Just a few more. Okay, now we're gonna do what I call reverse squats. What Francesca's gonna do is she's grabbing the bench to create a leverage, and then what she's gonna do is she's gonna lift her legs up, try to bend that knee a little bit. Ready, Francesca? Let's do 10 of those. Ready? Let's go. Just lay down there. 3, 4, 5. So this therapy is intended not just to make her knee more stronger and flexible, but also so she can work other parts of her body. Francesca is very active, she's a gymnast, and she doesn't want to lose the strength of her core and upper body. That's why we're implementing all those other exercises into her physical therapy, so she can recover, but at the same time she can get the benefits of functional workout. Okay, let's do one more set, 10 more. Ready? Try to flex a little bit that knee, so you want to create flexion. Yeah, very good. So now we're on this stretching machine. We're going to stretch a little bit that knee. So your left foot needs to be a little bit more on a 45-degree angle, Frenchie. A little bit more. Right there, very good. Okay, so now what you're going to do is control your body weight with your arms, and you're going to try to flex forward. You want to go forward and flex your knee as much as you can. Okay, and just control the move. I always suggest that from a scale of 0 to 10, when you hit about 6, of course being 10 the hardest and 0 the easiest, when you hit about 6, that's probably where you want to start. Especially when a surgery like that, it's really easy to get from like 6 to 10 in only a little bit of a flexion. So you want to go very slow. Okay, ready? Let's go. Let's get in, and you're going to hold it for 5 seconds. Very good. 5, 4, 3, 2, 1. Let's go back a little bit. Very good. stretch, yeah, you want to stretch the other way. Excellent. And hold it back there for 5 seconds. 5, 4, 3, 2, 1. Very good. Now let's go back to the front. And hold it for 5 seconds. This is probably one of the most important things we should be doing when we do physical therapy to recover from ACL, reconstruction, or meniscus. Just because what is more important to gain first is your range of motion. The strength can be gained later, but you probably need to spend more time in stretching and regaining your range of motion. Probably 60% of that and 40% of strength training. We already did a lot of strength training earlier, so now we're stretching. We're going to spend a little time doing this. 5 seconds there, and then we go 5 seconds back. You want to repeat this 10 times. Okay, we'll see you later when we get to our next stretch. Okay, so the next stretch we're gonna do is once you push your knee forward, once you're all the way forward, okay, instead of counting 5 seconds, what you're gonna do is move your knee in, keep your foot printed on that floor, and then move it to the right. Very good. That creates side motion. Very good. So now it's coming to the right. And now goes to the left. Very good. That's really good to stretch those tendons on the side of the knee for better range of motion. Very good. So we're gonna do this 10 times on each side, and you wanna hold it. Once you reach all the way to one side or the other, you wanna hold it for like 2 or 3 seconds before you start coming to the other side. Perfect. We'll see you in our next. So this is the last exercise of the day, the last stretch. And what Francesca is doing right now is she's flexing using the ball. We're right at the gym, so she's laying over there using the ball. And as you can see, there is no pressure at all. The only thing she's doing is just flexing that knee, try to get it back as far as she can. Okay, hold it over there, Frenchie, for 5 seconds. And remember, you need to feel about 6 in the scale from 0 to 10. You need to feel about 6 when it comes to stretching. You don't want to go over 6. Good, stay there for 5 seconds. Good. Now let's stretch back slowly. Very good. Very good. Let's go back again. Very good. Let's do one more. Okay. See you next time.